our workshop for this evening. I'd like to thank, I'm sorry, how do you pronounce your last name?
Pascasilla.
Pascasilla from East Shore Health Department being with us here this evening to answer questions that some in our community have as well as board members. So thank you.
You're welcome.
Thank you, Mike, for being here. We appreciate it.
Okay. Grab the microphone.
Just as an aside, Mike and his team from East Shore Health have been incredibly supportive and responsive to assisting the district from March all the way up through present, and have recently spoken with my school nurses, our administrators, now the Board of Education, and will continue to support us as we reopen schools and need guidance and assistance. So Michael, thank you for being here today. We're very appreciative of your support, your knowledge, and your expertise.
Okay. Erica, thank you for the invitation, and to the Board of Education, thank you for having me. So I do have a presentation prepared, and I'd like to go over the presentation, and at the end, if you feel the need to ask me a question during the presentation, feel free to, but if we could wait to the end, that would be great. And so with that, for purposes of people watching, my name is Michael Pascasilla, and I am the Director of Health for the town of East Haven. I'm also an educator. I teach public health at Yale University and Southern Connecticut State University, and I've been a public health official for about 30 years. I started my career as a health inspector. Over the years, I moved around, state government, local government, private, and now I'm the CEO for the East Shore District Health Department, and I serve as the Director of Health for the 3 towns of the East Shore District Health Department.
Mike, can you just be careful of that cord?
Yeah.
Thank you. I know it's not ideal, but...
All right. So we're going to be opening our school during a pandemic. This is unprecedented, at least in modern history, and there are going to be some challenges. That said, we do have a strong plan. We've been working together, and I'll go over some of the details after. I want to just give you a quick overview on our involvement. So the first thing you should know is and will be regularly talking. My staff and her staff, we have some process set up so we can share information, especially when we have to do contact tracing. The other thing you should know is myself and Erica, aside from our full-time jobs, one of the things that we've been doing is assisting the state, and we've sit on some committees to help get some of these rules that the state needed help with. And so I know Eric has been very involved, I've been very involved, and it's also given us an insight because the state is listening to us. And we had some really good input. So you need to know that above and beyond everything else we're doing, we've been assisting the State Department of Public Health and the state education. Striking a balance between public health and education. And that's really what we're talking about. We want to open our school, educate our kids, they need to be here. But at the same time, we have to think about public health because safety is our first priority. And our decisions have to be made based on science and statistics. There's going to be many times there's going to be lots of emotions. I know there are a lot of parents that are feeling anxious. Some parents are scared. I have friends and family that they call me up. My wife and I have to make the same decision about are we going to send our kids to school or not. So I see it from both sides, not just as a public health official, but as a parent. And I certainly understand some of the decisions that have to be made. data.
Because this is what's really going to drive our decisions as a community. So, with the data, if we look at some of the data, you can see that May, June, July, August. So, unfortunately, it's not showing up on here, but we had 15 cases in June, 20 cases in July, and we're at 14 in August. And you can see how it's spiked. If we look at the last several months, and compare it to the state, the last slide is the state, it's pretty much matches. There is some variance, but for the most part, it's matched. And you can see the different age groups. When we look at testing, testing has fluctuated over the last several weeks a bit. We had a little spike about 6-7 weeks ago, but in general, 400 to 500 people are tested per week.
He's having technical
All
difficulties.
right. So, with respect to data, when we look at state data and local data, there's different metrics. So, what is a case definition? This is important. A true case is a laboratory or COVID-19 diagnosis. That is what a true case is. Just because someone is sick doesn't make them a case. Obviously, it's something we'll be involved in, but we want that positive test when it comes to contact tracing. It is confirmed through 2 ways, PCR or an antigen test. And then, what's the contact? And so you have a case, and then there's a case definition of contact tracing.
So contact is a individual that's been exposed. The exposure is for at least 15 minutes, less than 6 feet. Social distancing is important. And direct exposure, and so that means they don't have a mask.
Contact tracing, what's contact tracing? You hear a lot about contact tracing.
And so we are equipped at the local health department to do intensive contact tracing. And so we get a positive case, and it's through a case report. And then we do interviews with the individuals that have, who are ill and the people they've come in contact with. And then we do contact notifications. And so how it plays out, let me just give you an example. A student comes to school, gets sent to the isolation room. That individual is sent home. They get a test. It comes out positive. They get put into our database. We start working with school officials, and we have our processes worked out. And then from there, we assess what kind of exposure is it. And if it's a significant exposure, then people get put into quarantine. And then we talked about family members, and we look at other things that they've been doing. Have they gone, for instance, are they playing sports? Did they go to a recent event? And so basically we follow the dominoes. And anybody in contact has a significant exposure to the person who's positive COVID-19, we want to put those individuals into quarantine and the person that is sick into isolation.
Mike, can you just hold the microphone just a little bit closer to your mouth?
Sure.
Or your mask, rather?
How's that?
That's good, thank you.
Okay.
Can I ask, I know you asked not to be
No,
later, but
it's okay.
I think it would be helpful if you said again, what is significant exposure? I think
Sure,
that would be-
sure. A significant exposure is an individual that comes in contact with someone who's ill, positive of COVID-19, for 15 minutes or more, less than 6 feet, and no mask.
No mask.
Yes. I'm not going to get into the weeds of this individual slide, but it gives you an idea in-house what we're doing and how we do contact tracing. And it's our decision-making metrics, where if someone gets ill, decisions have to be made. Are they positive? Are they negative? Are they going to test at all? And then we go through the decision tree with the contacts. So when it comes to making decisions with data, there are leading indicators and secondary indicators. So leading indicators, we look at the average of 7 days, and we see how many cases per 100,000. Secondary cases or indicators are the percentage of those positives. So of the 100,000 people who got ill, how many people actually tested positive? We look at hospitalizations, and that is key, because while it's a secondary indicator, if we see hospitalizations go up quickly, that tells us that there are other exposures out there. And so that is one of the decisions that we make when it comes to how we're going to handle whether school will stay open, go virtual, or hybrid. And then we also look at COVID-19 and influenza. So it's not just COVID-19, we also, as a secondary indicator, we see what other illnesses are going on in the community. This is a model that the State Department of Public Health is using. It's out of Harvard University. And with the 3 color codes, right now we're in yellow. All right? And so what that means is,
Which one's yellow? The middle one?
oh, it's yellow on my screen. All right, so it would be top one, it would
I'm
be
sorry, I
sort of
really
a
can't tell.
green, a lighter green.
Okay.
That's where we are right now, which indicates that a school can open full in person. If we start trending down into the darker shade of green, that would indicate that we need to consider maybe a hybrid model. And if we go into the red, that tells us that it's when we look at Connecticut's positivity rate right now, and even our local rate, in Connecticut, it's about 2% right now, okay? And so if we go back to the indicators, at 2%, we're in yellow. When we look at the positivity rate, this is where we were, and here's where we are. And so you can see at one time we were pretty significantly high. Over time, we've leveled out. Now, that's not to say we're not still getting cases, because we're still getting cases. In fact, in Connecticut over the weekend, yesterday we had over 400 cases, and today we have 29. And part of and how the data flows is it sometimes goes in batches, and so we got these ups and downs. But in general, in Connecticut, we're getting somewhere around 700 to 800 cases per week. When we look at COVID-19 hospitalizations, again, we have some hospitalizations, but they're relatively flat, meaning that there's not many going on right now. And then when we look at COVID-19-like symptoms and influenza, right now emergency room visits are relatively low. So we're in a good place right now to open our schools. Within this chart, it's another type of metrics that looks at county data. Again, goes back to the color chart. And if you look at New Haven County, we're about 2.2. In the state, we're about 2.1. So in general, what that means, again, right now, to open our schools in person, based on community spread going on across the state, going on across our county. And if you look at our local data, it supports opening school 100% in person. Let's talk a little bit about isolation and quarantine. People get these mixed up. And just to clarify, isolation is a sick individual. So the person is ill, and when we put someone in self-isolation, it's to keep them from spreading the disease. Quarantine is similar, except it's people who are healthy, and we want to see if they become ill because they may be contagious. So that's the difference between isolation and quarantine. And so with roles and responsibilities. So our State Department of Public Health, Education, and the Governor's Office has given out many different guidances. Some of those guidance help us at the local level make decisions. Some of them are pretty firm guidance, but there are some of the guidance gives us flexibility to look at how we want to do things locally, because there has to be, in a school setting, there has to be that flexibility. School district and local public health have been working together, and I wanted to bring this to give you an idea of, this is for the town of East Haven. There's hundreds of pages in here. Includes the plan, a very well thought out plan. District. It has some state guidance. In my opinion, this is a very strong plan. I think we're in a very good place with our planning. What I will say is what we could expect is we're going to have some level of positive cases. In fact, on a weekly basis, we're still getting positive cases in East Haven. I would tell you they're relatively low, but every once in a while we have a little spike. But right now we're in a good place. Been working with the mayor's office on a weekly basis, superintendent, fire chief, police chief, the mayor, mayor's assistant, and my staff. We get together and we go over the data. And we talk through the incident command system of where we are. We talk about businesses. There's been a few violations that we've had to deal with. We're getting lots of complaints. And as part of that process, we're working with the school and seeing how not just the health department, but all town officials can support the schools. One of the things I want to emphasize is when it comes to COVID-19 and keeping our community safe, we can't do it alone. So the health department has a role, the mayor's office, police, fire, our schools, but we're going to need help from our community. And simply put, and to be honest and sincere, and I'm reaching out to our community, everyone watching, we're going to need your help. We cannot do it alone. You need to do your part. So here's our ask. From a public health standpoint, face coverings, they are not optional. People need to wear face coverings. We can't have vented masks. So you're seeing a lot of these vented masks pop up. They're not going to be allowed in schools. some of the guidance with face coverings, because we're seeing all kinds of face coverings. They should be multi-layered. 3 layers are best, and some of the cloth masks are up to 3 layers. Some of the masks the paper masks are also, they're multi-layered. And you can't blow a candle out of it, all right? So that's some of the guidance that we've been given from the CDC and the State Department of Public Health. Social distancing. The more distance that you have, the safer you get. The closer you get, the risk increases. Sick individuals. If you're sick, and this is just not just for COVID-19, it's for the flu, it's for cough and colds and everything else. You want to stay home. If someone's sick, especially in our schools, we need to keep sick children out of our schools. When we talk about risk, it's one of the highest risk. So asking all the parents out there to please, if your child's ill, do not send them to school. Take their temperature, monitor their health. That's really key. We need your help with that. Some of the other things there, and you've heard this from the governor and the CDC and some of the other media outlets, avoid travel. Travel in general, the more you travel, the more interactions you have with people, the higher the risk. Large events. We're having a number of outbreaks right now in Connecticut where people are having large house parties. And we are currently investigating outbreaks. And so we really need people to avoid large gatherings. It's really important because what will happen if those individuals gather and people become ill, it's going to impact our children, and then they're going to come to school, and then more people are going to get sick. And with special education, when we talk about mass special education, it's its own cohort. We have individuals with behavioral health issues and special needs, and so those individuals do not have to wear face coverings. If they can, that's great, but if they can't, we have other safeguards in place. So next steps. We're going to open our schools, and we're going to monitor the public health. We're going to look at the statistics, state data, local data. And if we see an increase, we're going to have to make some decisions. But I believe that we have strong protocols in place in our schools right now. However, if those statistics get a little too high, especially in our schools, we may have to move to a hybrid plan or totally virtual.
Can I ask you a question?
Yes.
The hybrid plan. I've been doing some research, and they're saying that it may be more problematic than being in person, due to the cohort kind of getting blown apart.
So with a hybrid plan, there could be some unintended consequences that come with a hybrid plan. And so you could have parents, and we've already heard this, where if a child can't be in school all day, well then what are the kids going to do, right? So there may be some gatherings. If there's gatherings, and we've heard that some parents are getting together and doing daycare together and doing more things without the proper precautions in place, that could lead to some unintended consequences. So one of the things that we're seeing with our food service establishments, right, because restaurants are having a hard time right now, our businesses aren't doing very well. And so we have, we put restrictions in place on them, but what we're finding is we're finding people who are doing illegal catering and other illegal activities. And so every time we put a restriction in place, we have to weigh out the unintended consequences. And with a hybrid plan, on the surface, it definitely makes sense, but we don't know what those unintended consequences are. We're going to find out, but it's a balance between public health and education. So your point is taken. There could be some unintended consequences with a hybrid plan.
So Mike, will East Shore Health be working on making sure that the camps and the programs and sort of people organizing large amounts of kids and supervising them during a hybrid plan, that they are doing it safely? Because you could potentially have large amounts of kids across multiple communities going to a common place on a campground. I mean, I'm getting flyers as a parent where Camp Laurelhood and Camp Hazen are opening up for kids to go there on the days that they're not reporting to school. Now you have parents sending kids from, you know, dozens of communities in one location, and then those kids reporting back to school for 2 days. So it maximizes and elevates the level of exposure. So are those camps under the same guidelines as we are as schools to make sure they're doing their due diligence relative to safety, so that when the kids are coming back into our buildings, we know wherever they've been under the, in places that are under the same scrutiny in terms of guidance that we are?
Excellent question. We're getting reports of some businesses that are opening to do different types of daycare and other kinds of services to keep kids busy. Some of these are not licensed, so in order to be a daycare, you need to be licensed. We're having these conversations with the state and how we're going to handle it. We've already seen it with sports. When we canceled some of the sports, families got together and they decided to have their own sort of leagues. Again, those are the unintended consequences that we're dealing with. So we make it safe in one way, but we have to play out the unintended consequences. So we're looking at that right now. I know the governor is concerned about it, and his staff, Department of Public Health, Education, the Office of Early Childhood is concerned because daycares are licensed under them. So it is a concern. We're going to be putting out some messages to those individuals and letting them know that if it's, for instance, if it's a daycare, they need to have the proper licenses. If we find out about it, then they're going to be asked to close, and there may have to be some enforcement. So we're hoping that's not the case, but the reality is it may be. Yeah, it's a great point.
That's when the contact tracing, I think, comes into play, because right now, you know, as a community in East Haven, we've had 0 cases 18 out of the last 25 days. And so, you know, any changes in that information on exposures and contact tracing and how groups of kids are mixing regardless of our learning plan will be really, really important.
And that's why some decisions have been made with sports, some of the high-risk sports. You know, the state is working with the coaches and to see, you know, what can be allowed and what can't be allowed. And it's hard decisions. I mean, when we talk about sports and some of the gathering, I mean, humans are social creatures. This is what we do. And it kind of cuts the grain of what we're used to doing. But at the same time, our main goal is to keep our kids in the school and make it as safe as possible. We have a great plan that demonstrates that. However, activities like that, in the best plan, it's not going to work out. And so we have to, you know, make sure we're diligent about that. And through contact tracing, we will find out if they're getting together outbreaks, and we start calling folks and connecting the dots, follow the dominoes, we're going to find that, and we'll put a stop to it.
What about the 6-foot distancing? I know that seems to be an issue, and there's some ambiguity from the state level a little bit about that, and I think we should just put it out there. But the numbers could change as people, there has to be a final date when you know how many students, correct, are going to be in your classroom or in each classroom. So then you can work on that to be closer to 6 feet than ever. It really truly depends, and that's why we need those numbers, and that's why people aren't finding out until
So we have
very close.
Yeah, so we have those numbers, and as of today, 21.6% of students are choosing remote options.
Okay.
Do we know what average class size will be?
It ranges anywhere from 11 up until 20. After a certain amount, based on the building size, though, we are using alternative settings in the schools to spread kids out further.
So 20 would be the cap, we're not going beyond that in the classroom?
It depends on the school. Some
Okay.
schools have larger classrooms, larger spaces. It depends. Maybe that number is 16 at a different school because the classroom is smaller in that school. Maybe it, so the class sizes right now are ranging anywhere between that, but depending on the school facility and the number of large spaces in the schools, like the number of auditoriums and cafeterias and extra classrooms, we will break down those classes into those other areas. Okay?
That's good to know.
Yeah.
I have a question.
Questions over here?
Has there been any research or information about the prevalence of symptomless positive children?
Yeah. So asymptomatic is what we're talking about. So people who are ill but have no symptoms, or very mild symptoms that
They're
they don't even
contagious,
realize
though,
it.
even without symptoms, aren't they?
Some are around 40%-ish, especially in our kids, are asymptomatic. And that's what makes this virus really tough, is because you have people walking around who are asymptomatic, but they're shedding the virus. And that's where the social distance, wearing face coverings, and taking those precautions are really important, because they're ill, they don't know it, and they're spreading it.
Mike, I have a question. Over the summer, we ran some in-person summer school programs. So we had a 5-week program at Overbrook School for 69 3- and 4-year-olds with 14 kids in a class. They didn't wear masks because the OEC, it was not a requirement at that time. Staff wore masks. We didn't have any positive cases or any issues. We had people who weren't feeling well and who were ill but tested negative. We mirrored some of what we did at Overbrook in our plan, and will continue that when we reopen schools. What contributing factors based on our plan and what we did there do you think assisted in running a 5-week program with 69 3- and 4-year-olds in classrooms of 14 without masks for 5 weeks without any positive cases?
So what was the time frame of that in the summer? Early summer? Midsummer?
It was second week in June through the second week of August.
Yep. Things are changing a bit. There's a lot of more and more people are getting a little frustrated. They have cabin fever. They're being
So
a little
I'm
complacent.
sorry, my question was, what factors do you think? Like, was it the sanitation attendant? Was it the fact that our staff was wearing masks and shields? Was it routines and outdoor play areas? Was it our sanitation?
I think it was
toys? Like what?
a combination of all that, but we have to also know that people were following the rules a whole lot better back then. What we're finding now are people are not following the rules. They're getting complacent. They are not wearing face coverings. They have checked out. So I think things have changed a little bit, but then it's all the above, all those extra precautions that you put in place. So I think it was multifaceted. There wasn't just one thing.
Okay. And we ran a couple of summer school programs at Deer Run in the high school, in our extended school year program that Bob did, where kids were wearing masks, and again, those were 4-week programs.
Those are 6 weeks.
6 weeks programs,
6
and we didn't have any issues, and we're mirroring some of the strategies we used then in the reopening for our kids.
And Mike, we did have success with even 3- and 4-year-olds with mask wearing, and all of those students have significant disabilities. So, there's some training and teaching involved. That's what we do. So, it went quite well.
Yep.
Mike, one of our board members behind you has a question.
Hi,
Yes.
I'm
Hi.
Jennifer. I think a lot of the parents and the teachers as well want to know more of the protocol if someone does test positive in the classroom.
Okay.
Yes.
So we can go over that. So someone tests positive, right? So let's just play that out, how it's going to play out. Either over the weekend, we're going to get a call, or they're going to enter our database. Once they enter our database, then we make contact with the family, and we go through a series of questions. We want to know, what the family entails, because those are all contacts, right? And then where have you gone? And then we look at the timelines. So before you get sick, you have several days before where you're infectious. So then we back up the clock. And we just say, okay, tell us where have you gone? What have you done? And if they went to a birthday party, well, that's a significant exposure. So now we want to know who organized the birthday party. We're going to talk to the people there and get those contacts. And then we follow the dominoes as best we can. And we need people to cooperate with us. And we put those people in quarantine. So the individual who's ill goes in isolation for 10 days. The people who go into quarantine for 14 days. Because we have to count those days before.
So now that includes the kids that they were in the classroom with?
It depends on the exposure. If it's considered a significant exposure, the short answer is yes. But if we have someone, let's play it out with school now. So Monday morning, we find out a child's not feeling well, right? They have COVID-like symptoms. They go to the isolation room, they're assessed. Yes, this is a risk. Parents come picking them up. They get tested. Now it's a case, right? If it turns out to be positive. We talk to the school administrators, we talk to the teacher, and we want to know, were people wearing their face coverings? Were they social distancing? Basically, were they following the rules? Were they following the plan? And if the answer is yes, it may not be an exposure. Just because you're in a room with someone who is ill doesn't make it exposure. It's all those other factors. If we find out, well, so-and-so didn't wear a mask, and they were sharing lunch, and they were hanging on each other, that becomes an exposure. And so it could be a couple people in that classroom, or it could be the entire classroom. So every situation is different. We have to look at the full picture. Does that answer your question?
Yes.
Okay.
And I think, I love your question, Jen, because a lot of people are asking about that, as well as that's why they're not getting a definitive answer right away. In other words, they want to know, how come we don't have a plan if someone that we're late to the plate with that? And I don't feel we are, because you just said it's a case by case, and you have to right away go through those protocols. Am I right?
Yeah, it's all about risk.
I just think that needs to be really,
that,
really said, because that's
absolutely.
where the fear comes from.
Yeah. So the
Nothing's going to be hidden.
No, we're going to be transparent.
Yes.
But if there's not a risk, I mean, we do this all the time, and so
Yes.
we're talking about COVID-19. We do it for TB. We do it for many other kinds of communicable diseases. And so if we feel it's a risk, then we're going to let people know. We have to. That's our obligation, because if we don't, then more people will get sick. But if it's not a risk, we don't need to inform everybody every single time. Now, confidentiality plays into this too through the HIPAA laws. We don't ever give identifiers. Right? So names will never be given out, ever. Not allowed, against federal and state law. But if we determine that classroom was impacted, then we're going to let everybody in that classroom know. And we may put everybody into quarantine, or maybe just a few, or maybe none. Because we want to keep the kids in school as much as possible, but that's where the balance comes in. And that's why we need Good communication with our families when we call, because internally we already have it ready. We're ready to go. We have our policies, our procedures. We're ready when we get those cases when school opens. But our role is only going to be as good as the people we call and if they cooperate with us, and we really need their cooperation.
And just to ask, we can't mandate anyone to be tested, correct?
Correct, and if someone decides, so let's play that scenario out, that individual who has COVID-19 or like symptoms, parents, for whatever reason, they decide not to have that child tested. That child does not come to school for 10 days, automatically. Another scenario is they go to the pediatrician and the pediatrician says, oh, it's not COVID-19, it's seasonal allergies. They get a medical clearance, they could come back to school. All right, so there are different scenarios, and that's why contact tracing is important, and that's why every situation has to be evaluated.
As far as the buses, our in-person is going to be around 78%. Do you have the number how many said that they would be taking transportation with the buses?
Yes, it's a lot less than that. We're working on the final details, but a lot of parents have stated that they will be driving their children. So we have been working with East Haven Police Department for traffic control, talking about some staggered drop-off and pickup times, making sure that buses and cars are separated from arrival and dismissal. That's a whole operational piece that we're working on. We do anticipate that buses will not be running at full capacity given the fact that 20% are not reporting and a certain percentage of those kids will be dropped off and picked up instead of taking the bus.
Now, Mike, my other question is, because we are, obviously using bus transportation and the children, I would assume, are sitting two in a seat. If need be. If not, depending, we might be able to assign seats further apart, Right. one in a seat, yep. So would that be considered under the significant exposure, where the kids are gonna be sitting there, they're gonna be masked, the windows will be open? I mean, is that all factors in?
Yes, it is.
Bus
So,
is a safe transportation route?
so through contact tracing, if we find out that same student who now is in self-isolation was on the bus, and that people were switching seats and not wearing face coverings, well, no, that's an exposure.
Right.
And so those people would have to go into quarantine. Again, we have the plan. If the plan is followed, it's going to work well. Yeah, we're going to get some cases. It's just a given, right? Let's just put that out there, set expectation, right? Under the best plan, we're going to have some situations. But if we follow the plan and people do what they're supposed to do, we're going to keep that risk to a very, very low minimum. The other thing to mention is we're entering flu season soon. Get your flu shots. How that helps with COVID-19 is when we look at the flu and when we look at COVID-19, they're very similar. And if we find out someone has flu-like symptoms and they had the flu shot, well, it probably is COVID-19. It helps with the decision making, and it also protects people. And then I wouldn't be doing my job if I didn't encourage everyone to be the healthiest version of themselves. And here's what we know. The healthier an individual is, the stronger their immune system. And so, it's sort of that advice that we got from our grandmothers, eat your vegetables, exercise, take care of yourself, good sleep. So if you do get sick, it softens the blow. It's not as bad. Because the data shows us that the healthiest people, while there are some outliers, healthy people fare well. Obviously with age, that's a factor, but the healthier you are, the better you're going to do. And we also found out with elderly people who did get ill. The data shows that the healthier they are, they fared much better than people who didn't take care of themselves, who had other issues. Whether it was diabetes or high blood pressure, and the list goes on. So you got to take care of yourself. It really makes a difference.
Right, we have another question.
So the testing with the PCR and the antigen tests, because this may come up if one of the kids gets tested, are we accepting the rapid antigen test if it's negative as appropriate, or do they also have to get the PCR test?
No, we're accepting that test. But what everyone has to understand is if you get a test, a rapid test, it comes out positive, and then you get a PCR test, and it comes out negative, we still go with the first test as a precaution. All right, so we just got to make that very clear, that we go with whatever the result is, and and here's where we err on the side of caution, and that's CDC protocol.
Mike, I have some questions here that were submitted earlier online. One of them was, what is the appropriate amount of PPE that schools should have on hand?
So for obviously the teachers and your staff, you're going to need face coverings, nurses, specialized equipment, shields, gowns. Special education will need some of those also.
And like a 30-day supply for
Yeah.
all staff every day? Is that
I would say 30 days is good. More is better. Just in case we get a shortage,
Right.
we've experienced some shortage, so the better your supplies. But some of those supplies are still they're better than they were, but very quickly they can change. So I
we
would say a
have a
30-day
60 day.
supply.
We have a
60 days better.
Is there a
30 is adequate, 60 much better. You want to pad that a little bit.
All right. And also, there was one here, what is the closest testing site in East Haven, and how long do test results take?
So there's one on Foxen
So
Road.
I'm actually a PA at the urgent care.
All right, urgent care is the closest one, but Stony Creek Medical Center is another one. Yale's still doing it. Fairhaven Health. There's a number of sites that popped up.
So the urgent one, we do the PCR, but it's been taking 7 to 10 days to get the results, and our rapid test takes 15 minutes to get the results.
Wow.
Jen, how many tests a day are you doing about?
About 100 a day.
And what's the positive response, positive test result?
I don't know, maybe 1 to 2%.
Okay.
I wasn't there last week, but I don't know
Prior
about
to
last week.
that?
So our numbers right now in East Haven all indicate all the statistics and the mitigation things that you're looking at yield full return.
Correct. And it's not just in East Haven, it's surrounding communities.
Yeah.
All right, which
Right.
play into
I'm-
it, but yes.
I'm right down the street. We are full return in North Branford as well right now. I can say that.
Yep. Yeah, and I've talked to Scott.
Yep.
Did very similar conversations. In fact, we talk with Scott on a
Yeah.
regular basis as a district.
I think things get a little muddy when you get different districts doing different things, and it just makes everybody go, wait a minute, why, but I do understand, I see what you're saying. That's why I keep asking certain questions as well. Our teachers in East Haven are face shields if needed?
Every teacher received a little box that had extra, like gloves and a mask, wipes, a spray bottle, some of our sanitation tabs approved by the CDC, and it also includes a face shield. So yes. Yep. And
Yeah.
and we have additional face shields available. We also have these little plastic/plexiglass little individual barriers that for each one of the students that they can take with them to lunch or utilize in the classroom. It belongs to them. It's theirs.
Good.
And also for teachers.
Oh, that's right.
Yeah, so it's portable, so it folds up and they can take it with them.
That's awesome. No, that's good.
Just a few other things just to mention. What does the future look like? Because we keep getting that question. I think we need to accept and expect that societal restrictions are going to be implemented for the foreseeable future. And that's just the reality until we have a vaccine. Treatments are better. We've learned a lot in the last 6 months. We definitely can treat it better. A vaccine, what we're told, is after the first of the year, we're going to have a vaccine. It's going to be a 2-dose vaccine. And it's going to come in phases because once we get it approved, then they have to make it and ramp up production. Obviously, The entire world wants it, so we're going to be competing with the world. Our government is working with, last I heard, 8 companies. And Connecticut and the governor are working on supplies as we speak, and we're in the process of planning right now. And so first it'll be essential workers, then it'll be our vulnerable population, and then it'll be the general public. If all works out well and everything falls in place, within the next year, we'll have the vaccine, and we should be able to vaccinate the entire or very close to the entire population and achieve herd immunity. That's our goal. And just want to put a shout out to our teachers. They got a tough job ahead of them. I could appreciate that as an educator myself. I'm a father of 2 boys, and I definitely appreciate it. And I also have to put a shout out, and we've met with them, is our school nurses. They have a key role with us, working together. So our nurses, we have public health nurses, contact tracers, working with your staff, Erica. We've met. Again, I believe, and I want to send this message home to everybody, we have a solid plan. The plan will work, but only if our families and our students do their part. They really need to do their part. And so, face coverings, social distance. If you're sick, please don't come to school. Avoid large gatherings. And if we call you, talk to us. The more information you give us, those cases won't become clusters, which could lead to hospitalization. And unfortunately, our community has been hit, and we had a number of fatalities. We want to avoid that. We will avoid that, but we need help.
I think it's just as important for the children to get back to a routine, to school.
Mm-hmm.
As a teacher, I want to see my kids. And the more we can see, and maybe things will turn, hopefully for the better, but if they don't, at least we get the chance to meet them face to face and, somewhat, and eyes to eyes, whatever, and at least, form a relationship. So if you do go virtual, then you have a better chance of that being successful as well. That, I really do think that.
Yeah, I agree. While we have some parents that want to play it safe and do virtual, we respect that. I understand.
I do too. I see both
100%.
sides. Absolutely.
But at the same time, at some point, we all know when we look at the whole child, the emotional, the educational, even the physical, the package of how you learn, they need to be in school. That's how they learn the social skills. They want to be with their friends. They want to play sports. But unfortunately, for about the next 6 months, 8 months, a year, we're going to have to kind of hunker down and pull together. And hopefully next year at this time, we won't have to wear face coverings. I'll tell you, I don't like wearing a face covering, and I know you don't either. It's not fun. It's certainly not going to be fun for our kids. But it's, it's something that we have to do.
And we'll give them nice mask breaks outside, frequently, appropriately social distance, and work that into the day for sure. It'll be really important for both adults and students.
Yes, agreed.
Absolutely.
Yeah, mask breaks, and within the plan, we have cohorts. And so if we do get some ill individuals, we probably will, we're going to be able to contain, isolate, limit the exposure.
So Mike, just final, given today, data indicators, the combined indicators, the data today.
Last 2 days, 0 cases in East Haven. we're doing well. We want to keep it that way. And so, that's, this is a virus, and it needs to survive. It wants to survive, and how it survives is infects humans. So if we let our guard down, those numbers are going to go up. If we continue to do what we're doing, those numbers are going to stay low. Yeah, we're going to get some ill people, and we do, but compared to where we were, when we compare ourselves to the rest of the country, we're doing well, but we're not out of the woods. We're still in the middle of a pandemic, and it can change like that.
Right.
And that's why we need to be diligent.
And we'll be ready to respond and pivot based on the data that we're continually monitoring and recommendations from you.
Yeah, absolutely, yes. Yep.
Thank you
Thank
very,
you
very
You're welcome.
much.